And, first glance at this slide, maybe easy to look at that and think like, you guys don't work on anything at the state level. But this slide actually is a little deceiving because under each of these big categories, I think of them as sort of buckets. There are a ton of little policy issues, not little as in they don't make a big difference. I mean, little as in like they all fit under one umbrella. Some of these are very important and critical. So when we look at affordability, we're looking at sales tax breaks, we're looking at lowering registration fees. We're also looking at the actual cost of the product, what patients have to pay in order to access their treatments. Also looking at patient-centered care, making sure that you can go to your doctor and you can get a recommendation for a registration. Patient-centered care also has to do with making sure that patients have access to resources that they need, and also other methods that they may need to actually get the care they need. So patient-centered care includes things also like telemedicine, especially for those who may have mobility issues or may not have a driver's license of their own, making sure that you don't have to worry about getting to a doctor's appointment when you can just hop on your computer and get a recommendation all of the same. Patients don't need face-to-face care. They don't need a face-to-face exam and a physical exam in order to get a registration most times. And so it can be done through telemedicine unless your physician for some reason does need that physical examination. Then we also look at health and social equity policies. On the health equity side, I look at this as if we create a level playing field for everyone, no matter their abilities, their health status, or what conditions they have. So making sure that if someone is able-bodied and treats their anxiety with medical cannabis, it may be easy for them to hop in the car and drive to the dispensary and pick up what they need and go home. But other people, for instance, if somebody lives with epilepsy and they have uncontrolled seizures, they don't have a driver's license. So again, things like delivery and curbside pickup to make sure that somebody who can drive and somebody who cannot drive can get the same level of access, even if it's through different methods. Social equity is also looking at the licenses states give out to businesses, making sure that they're not just big corporations and companies who can afford licenses and receive licenses. As a young white person who advocates for cannabis, I'm always very, very intimately aware that I am not in the population that has been most damaged by the war on drugs, the most targeted by the war on drugs. And so it is one of my top priorities, and should be one of the state's top priorities too, to focus on social equity and really ensure that these populations that have been hurt by the war on drugs and that have been previously cut out of the industry are given the opportunity. It's not enough to just reverse policies and say, oops, my bad. States should also be looking to fix the damage that they've done. And that's where social equity comes in as well as making sure that no matter your income level or your geographic location within a state, that you have access as well. So you shouldn't be required to live in a big city in order to have a dispensary near you. Someone in rural Iowa should have a dispensary within the same distances of them as somebody in Des Moines would, or someone in New York City or Los Angeles. We also look at licensure and safety. So this is the administration side, but we're really concerned with making sure that the products that are on the shelves, the products that you guys are buying, are the safest products possible, making sure that states have adequate testing set up and training for those people who make the products, as well as adequate training and safety and licensure procedures for people who work in the dispensary, who may advise you or who may give you products, so that they are experts in this and you can go to them and ask them questions. much like you would a pharmacist in a traditional pharmacy. If they gave you a prescription medication, that people work in dispensaries should have training about the product they're selling as well. And then, of course, there's our big campaign of No Patient Left Behind. This also deals with recreational adult use laws. While we support adult use laws, this goes back to ASA is the only organization that is only looking out for patient interests. There are a lot of organizations that are working on recreational adult use. And while we support that, we believe our voice is stronger, focusing on patients and patient rights. So No Patient Left Behind to us means not standing in the way of recreational adult use, but being part of the conversation to ensure that they are not doing things that roll back policies that benefit patients, and making sure that patients are included in the discussion for what they need and what they may hurt them. So one example on this is for adult use cannabis laws. States look at this as a big moneymaker, and it is for them, in part because of the high taxes, both sales tax and excise tax, that they put on products. So part of us entering the conversation and really keeping patients at the forefront is when we emphasize cost and affordability, and that the state should not be making a profit off patients' backs. So if they want to add a sales tax or excise tax to recreational cannabis, that's fine, but they should have a sales tax and an excise tax exemption for medical cannabis products. So patients are not funding the state for getting a treatment that they need. So first and foremost, in my mind, with all of this, it boils down to patients should not be penalized or financially burdened, and it should not be on the patient's shoulder to finance anything in the state, including the medical cannabis program. They should be able to finance that through other means instead of subsidized through patients who are simply looking to treat their health conditions.